Welcome to another episode of Sisterhood of the Scalpel. I'm Dr. Maryam Zamani.
I'm Dr. Julie Khanna.
And today we're talking about the ICLS Advantage. Ooh.
Oh, yes. It's a big advantage.
We're going to reveal some of our secrets to you so that you know what you can expect when you start your surgical journey here with us. So this is a process that's been years in the making, years in the optimization and fine-tuning, and I certainly have changed some of my ways for the better ever since joining my colleague here, Dr. Khanna, in practice a couple years ago. And so I'm going to make this like an interview, Dr. K. We're going to ask you, what is it about the surgical journey here that is so unique? Because I absolutely love it, and I think we're always working on improving it. So let's go through that. I'm going to have you walk us through it.
Well, I think the things that make difference here at ICLS is when you have two female surgeons, we approach things differently. All right? Nobody's going to argue we listen better, most of the time. And there's a lot of also understanding of our body. Majority of our patients are female, but you know what? This still improves our communication with our male patients too, because we can be very open, we can be very honest, we can discuss, and we can delve into, like, why are you here? What's going on? We have those conversations with our patients. So first is that interaction, right? Mm-hmm. The discussion, the honesty, the openness, those are things that are really important.
Well, I think that's really interesting because sometimes, we know why our patients are coming in for an appointment. We know if you're coming in to talk about breast augmentation or liposuction. And I find sometimes my patients are taken back when I sit down in front of them and I say, why are you here? Tell me what brings you here. I know the overall reason, but I want to hear it from you. Is it that you're hoping to just feel better in your skin? Is it that you're bothered by the loose skin? Like, we get down into the nitty gritty and the underlying reasons, the motivations, because that's really important.
Why are you here today? Right? Mm-hmm. Because it's important to manage your expectations, and your choices are important. What surgery, when, downtime, based on that decision. So that's what's really important. It's communication. And then, that's that communicating beforehand, understanding why you're here, understanding what your expectations are. So together we can work with your downtime, your expectations, and give you the right operation for you today and now. So I think that's huge. And, the classic example is breast augmentation. We don't do sizing on the first visit. What's the number one reoperation rate in North America for the first year after surgery? Is size change. The number one reason for reoperation. Well, for us, that's almost zero, because we spend so much time before surgery making sure we understand your desires and your needs and helping you figure out what that is. So that's what's so important.
And I always tell my patients, it's like, sometimes maybe it's because of life experiences. Like, we love to shop, right? I'm a big shopper. I always like to try on my alternatives. And so I tell my patients, when you're coming in for a sizing, I make you try on smaller than what you think you want. I make you try on bigger than what you think you want, because I really believe in that Goldilocks rule. And I don't want you to ever walk away and think about what if, right? It's like when you're trying on different dresses, you try on every possibility that you think you may want. And then you feel reaffirmed in the choice that you have. So after surgery, there's no what if or, buyer's regret or anything like that, because you already explored that beforehand. Again, the female advantage.
The female advantage. So, for those patients, for the older patients like me, understanding what breastfeeding did to us, understanding how our bodies changed with pregnancy, weight gain, weight loss. Now the other end, menopause. Like, it's women understand women, and I think that's a really, really critical thing. So then we have an intraoperative advantage, and for us in the OR, it is all about efficiency, safety, and giving you the best result. And it's interesting. There was an article that was published recently, and it showed that your complication rate was lower if you were a male or female patient. It didn't matter if you had a female surgeon. Now, we know that. And I've known that since I was a little girl. I used to have on my wall when I was 12, a surgeon should have the eyes of a hawk, the heart of a lion, and the hands of a woman. And we're just going to leave that at that. So that's pretty exciting stuff. But it also is what we do in the OR in terms of technology. Like, we are at ICLS cutting edge. We are the first, and we bring in technology to help our patients so quickly. So that's a huge advantage to our patients. Whether it's product, and Dr. C, we brought in Elastin.
And we're the first clinic in Canada to introduce that. Now, that was something I had experience with from some of my American training, but it's a product that we know from experience that helps what we utilize before you even start your surgery, right? We started beforehand, and we know that it helps improve your outcomes after surgery. It decreases your downtime, your swelling, your bruising, your wound healing, your scars look better. But it's about, again, knowing what's out there, knowing what's on the cutting edge, knowing what works. That's the important thing. We're not just about fads and, trying every product on the market that comes out, because there's millions of things that come out, and there's always, gimmicks. But for us, it's about things that are proven, tried and true, and we know provide an advantage to our patients. So we are very selective about what we introduce here at ICLS. It's not, we don't have every device, because every device, we just buy whatever comes out. We utilize what's on the cutting edge, what's the latest, and we've kind of have always been at the leading front. So if there has been a technology that's been proven to be effective, we've introduced it to our patients, and we've kind of collected some toys over the years.
That's such a great point, Dr. Z, that not only are we about the data, but we call the people who are involved. We are on the ad boards. We are right there to learn at the cutting edge. We are not just passive. We are active in this learning process. So that's a huge ICLS advantage. And we have the advantage that people know us too. So they talk to us, and we find out the skinny. We find out the skinny before anyone else does.
Absolutely. And I think that's something maybe we don't talk about enough, is that I want our patients to know about the influence we do have in the plastic surgery field. And that is quite unique for female surgeons as well, because it is still a male-dominated industry. Dr. Khanna speaks on many podiums. She sits on many advisory boards. And I'm part of the Aesthetic Surgery Journal, which means that I get to see some of this data before it even gets published, before any other surgeon gets published. And I help to decide if the research is good enough for that to even get published. So that's kind of my role. So we're both very engaged, because we think it's so important in terms of delivering excellent clinical care and outcomes for our own patients. So we implement what's good.
That's another ICLS advantage. We don't sit back and find out about stuff. We are actively out there learning about stuff, and part of the learning process and part of the teaching process. That's what we do. So post-op. I think post-op is probably the most important. And because, it's easy. Okay, you book surgery, you're all excited, but then the reality hits. And one of the things about the ICLS Advantage is I'm going to have to give a shout out to our nursing team, which is spectacular. I mean, Brenda's kind of okay. Now, Brenda's been with us 19 years. Okay. And we have some newer nurses, Aliana and Erin, and they're all awesome. Every one of them is awesome. And when you talk about the ICLS journey, you cannot talk about it without our team. They all are caring for patients, and their primary goal is to take care of patients. So if you call in and you're not sure, they're like, hey, we'll get you somebody. You've got a 24-hour hotline to call. You've got email places to answer questions, because it's kind of scary, but it's not scary if you're not alone. So that is the ICLS Advantage. You will not feel alone, even after the fact.
So thank you for staying tuned with us in this episode. We hope that this gave you some insight, some never before discussed little tidbits about what we do here at ICLS, what Dr. Khanna and myself bring to the table that we're really proud and passionate about in our work. And if you have any questions, and if this video piqued your interest, please don't hesitate to reach out to us. We look forward to seeing you here in our clinic. Stay tuned, subscribe wherever this little link comes up, and we'll see you next time. Bye.